Pinworm infection, caused by the parasitic worm Enterobius vermicularis, is believed to have affected humans for many millennia. However, the first documented case or discovery of pinworms is less clear. The presence of pinworms has been identified in ancient human coprolites, fossilized feces, indicating that this parasite has been a common human affliction since prehistoric times. The formal scientific recognition and description of the pinworm likely occurred much later, during the period when modern parasitology developed. This would have been in the 18th or 19th century, a time when many parasites were being described scientifically for the first time. Unfortunately, the specific date or year of the initial discovery or description of pinworms in scientific literature isn't readily available in common knowledge sources and would require more specialized historical research in the field of parasitology. Pinworm infection, caused by the parasite Enterobius vermicularis, follows a specific cycle of transmission and development, primarily within the human gastrointestinal tract. The infection process unfolds as follows. The cycle begins with the ingestion of pinworm eggs. These microscopic eggs can be found on contaminated surfaces such as bed linens, clothing, toys, kitchen utensils, or even food. The eggs are notably resilient and can survive for several weeks outside the human body. After the eggs are ingested, they make their way to the small intestine. It is here that they hatch into larvae. These larvae then continue their journey through the intestinal tract, moving towards the large intestine. In the large intestine, they mature into adult worms. A key part of the pinworm life cycle involves the female worms. These adult female worms migrate to the anal area, typically at night, and lay eggs. This activity often causes itching around the anus. The itching leads to scratching, which can transfer the eggs to the fingers and under the fingernails. Once on the fingers, the eggs can easily be spread to various surfaces, or they might be re-ingested by the same individual, leading to self-infection. Additionally, the eggs can be transmitted to others through direct contact or via contaminated objects. If these eggs are ingested, whether by the same individual or someone else, the cycle of infection starts anew. As a result, pinworm infections can persist and spread within groups, particularly in environments like schools or households. Prevention of pinworm infection focuses on maintaining good hygiene. This includes regular hand washing, especially after using the bathroom and before eating, keeping fingernails clean and short, and frequently washing bed linens and nightclothes. Pinworm infections are more commonly observed in children due to their habits of hand-to-mouth contact and less consistent hygiene practices. However, adults can also contract pinworms, especially when in close proximity to an infected individual. Pinworm infection, caused by the parasite Enterobius vermicularis, is particularly common among children and can manifest with a range of symptoms, though it's also possible for individuals to be asymptomatic. The most noticeable symptom of pinworm infection is anal itching. This itching is typically more intense at night and is caused by the female pinworms laying eggs around the anus. The discomfort from this itching can be quite significant, often leading to disturbed sleep or insomnia. In conjunction with the primary symptom of itching, affected individuals, particularly children, may exhibit signs of restlessness and irritability. This is often a consequence of the discomfort and lack of sleep associated with the infection. Some individuals with pinworm infection may experience mild abdominal pain. This discomfort is not always present but can be an indication of the infection. Nausea is another possible symptom, although it is less common compared to the itching and discomfort in the anal area. A notable concern with pinworm infections is the risk of secondary infections. The intense itching can lead to scratching, which, if done with unclean hands, can introduce bacteria, potentially leading to bacterial infections. In females, there's a possibility that the pinworms might migrate and cause vaginal itching or even discharge, adding another layer of discomfort. In more severe or prolonged cases of infection, symptoms like weight loss and a decrease in appetite can occur, although these are relatively rare compared to the more common symptoms of itching and restlessness. Due to the varied nature of these symptoms and the possibility of being asymptomatic, medical attention is advisable if a pinworm infection is suspected. Diagnosis usually involves identifying the worms or their eggs, and treatment typically includes medication that is effective in clearing the infection. Treating pinworm disease, which is caused by the Enterobius vermicularis parasite, is typically straightforward and involves the use of specific oral antiparasitic medications. Commonly prescribed medications for this condition include mebendazole, albendazole, and parental pomote. These drugs are effective in paralyzing and killing the adult worms. They are usually administered in a single dose, with a repeat dose often recommended after 2 weeks. This second dose is crucial as it ensures the elimination of any newly hatched worms, since the initial medication does not kill the eggs. In addition to treating the infected individual, it's often advised that all household members undergo treatment simultaneously, even if they are asymptomatic. This approach helps to prevent the spread of the infection within the household, as pinworms are highly contagious. Hygiene plays a critical role in both the treatment and prevention of pinworm infections. This includes practices like regular hand washing, particularly after using the bathroom and before meals, maintaining short and clean fingernails, and refraining from scratching the anal area. Washing bed linens, towels, and clothing in hot water and cleaning living areas through vacuuming or wet mopping are also important to eliminate any eggs that might be present in the environment. Ensuring the cleanliness of commonly touched surfaces such as doorknobs, toys, and bathroom fixtures is vital, given that pinworm eggs can survive on these surfaces. This environmental cleanliness is a key component in preventing reinfection. Given the ease with which reinfection can occur, maintaining these hygiene practices is as crucial as the medication itself. This is especially important for children, who should be taught the importance of hand washing and other hygiene practices. For the most effective treatment and prevention plan, it's essential to consult with a healthcare provider, particularly for specific populations like young children, pregnant women, or individuals with underlying health conditions. The healthcare provider will recommend the appropriate dosage and treatment regimen tailored to the individual's needs.